Assalamu alaikum. In this part of our lecture, we will continue our discussion about the anatomy of the front of thigh. Last topic was about the cutaneous nerve supply and superficial venous system of the lower limb and the fascia of the thigh and the lymphatic drainage of the thigh. And today we will continue our discussion about the fascial compartment of the thigh. 3 fascial septa pass from the inner aspect of the deep fascia of thigh to the linea aspera of the femur, an important landmark on the femur. By this means, the thigh will be divided into 3 compartments, each having muscles, nerve, arteries, and the compartment are flexor compartment or the anterior compartment, medial compartment or the adductor compartment, and posterior compartment or extensor compartment of thigh. Content of the anterior fascial compartment of the thigh include muscles. These are the sartorius, iliacus, psoas, pectineus, and quadriceps femoris muscle, which compose of 4 muscles. One is called rectus femoris, and the 3 vasti, that's the vastus medialis, vastus lateralis, and vastus intermedius muscle. Blood supply coming from femoral artery, nerve supply coming from femoral nerve. Femoral triangle. This is a weight-shaped depression, triangular in shape, formed by muscles in the upper thigh at the junction between the anterior abdominal wall and the lower limb. As it's triangular in shape, it is 3 borders. The borders are superior border, which formed by inguinal ligament, lateral border formed by sartorius muscle, and medial border which formed by adductor longus muscle. It has a floor which is formed by also muscle from lateral to medial by iliopsoas, pectineus, and adductor longus muscle. It has roof which is formed of skin and fascia of thigh. Its content are femoral nerve, femoral artery, femoral vein, and the deep inguinal lymph nodes. And this figure shows the femoral triangle. Superiorly inguinal ligament, laterally sartorius muscle, medially adductor longus muscle. Adductor canal or subsartorial canal. This is a fascial canal, lies beneath sartorius muscle on the medial aspect of the thigh. It connects apex of the femoral triangle to opening in the lower end of adductor magnus muscle. The wall of adductor canal are anteromedial wall formed by sartorius muscle, posterior wall formed by adductor longus muscle, lateral wall formed by vastus medialis muscle, which is part of a quadriceps femoris muscle. Content of the canal are terminal part of femoral artery, and femoral vein, deep inguinal lymph node, saphenous nerve, nerve to vastus medialis, and terminal part of obturator nerve. And here is the area of subsartorial canal, which connect the apex of the femoral triangle to the opening in the adductor magnus muscle, which is called adductor hiatus. Femoral sheath. This is a downward extension of the fascia of the abdominal wall into the thigh and is continuous superiorly with fascia transversalis and iliac fascia of anterior abdominal wall. It surrounds the femoral artery, femoral vein, and associated lymphatic vessels for about 2.5 centimeters below the inguinal ligament. It has 3 compartments. The femoral artery occupies lateral compartment, whereas the femoral vein occupies intermediate compartment, medial to the artery, whereas the lymphatic vessel occupy the medial compartment. This diagram shows the femoral sheath with its 3 compartments: lateral compartment by femoral artery, intermediate compartment occupied by femoral vein, and the most medial compartment is occupied by lymphatics. Femoral canal. This is the small medial compartment of the femoral sheath which containing lymphatic vessel. It's about 1.3 centimeter in length, and its upper opening is called femoral ring and is closed by a condensation of extraperitoneal tissues called femoral septum. The femoral canal contains fatty tissues, lymphatic vessel, and the upper deep inguinal lymph node, and it represents a potential site of weakness for an important disease called femoral hernia. This is the femoral canal. As you see, it is opened above into the abdominal cavity by an opening called femoral ring. Femoral ring. The relation of the femoral ring: anteriorly inguinal ligament, posteriorly superior pubic ramus, laterally femoral vein, medially is lacunar ligament. This lacunar ligament, it represents the medial end of inguinal ligament. The lower end of the femoral canal is closed by adherence of the medial wall to the femoral vein. Blood supply to the anterior facial compartment of thigh. Femoral artery. It enters the thigh from behind the inguinal ligament as a continuation of external iliac artery, and here it lies midway between the anterior superior iliac spine and the symphysis pubis. The femoral artery is the main arterial supply to the lower limb, and it descends almost vertically towards the adductor tubercle of the femur and ends at the opening in the adductor magnus called adductor hiatus, where it enters the popliteal space as a popliteal artery. The relation of the femoral artery, anterior relation in the upper part of its course. It lies superficial, it's covered only by skin and fascia. In the lower part of its course, it passes behind the sartorius muscle. Posteriorly, the artery lies on the psoas muscle, which separates the artery from hip joint, pectineus muscle, adductor longus muscle. The femoral vein intervenes between the artery and the adductor longus muscle medially. It is related to the femoral vein in its upper part of its course. Medially, it is related to the femoral vein in its upper part of its course. Laterally, the femoral nerve and its branches. This is the femoral artery. You can see medially is the femoral vein, laterally femoral nerve. Anteriorly in its upper part is superficial, covered only by skin and fascia. In its lower part is covered by sartorius muscle. Branches of the femoral artery are superficial circumflex iliac artery, superficial epigastric artery, superficial external pudendal artery, deep external pudendal artery, descending genicular artery, profunda femoris artery. And this last one, profunda femoris artery, is a large and important branch which arises from the lateral side of the femoral artery, about 4 centimeters below the inguinal ligament, and it passes medially behind the femoral vessel to enter the medial facial compartment of thigh. It ends by becoming the 4th perforator artery. At its origin, it gives off medial, lateral, femoral circumflex arteries, and during its course it gives the 3 perforator artery, and as you know, it ends at the 4th perforator artery. You can see this is the femoral artery and this is the profunda femoris artery, as it gives medial femoral circumflex and lateral femoral circumflex arteries, and then it will descend downwards on the medial compartment of the thigh, gives perforator arteries. These are the 3 perforators artery, and it will end at the 4th perforator branch. What about the nerve supply of the anterior facial compartment of the thigh? It comes from femoral nerve. It is the largest branch of lumbar plexus. It emerges from lateral border of psoas muscle within the abdomen and passes downward in the interval between psoas muscle and iliacus muscle and lies behind the fascia iliaca and enter the thigh lateral to the femoral artery and femoral sheath behind the inguinal ligament. About 4 centimeters below the inguinal ligament, the femoral nerve will terminate by dividing into anterior and posterior divisions. The femoral nerve supplies all muscles of the anterior compartment of the thigh. The anterior division give 2 cutaneous branches and 2 muscular branches. The cutaneous one is the medial cutaneous nerve of thigh, The second one is the intermediate cutaneous nerve of thigh, which supplies the skin over the anterior and medial side of the thigh. Muscular branches, they will go to sartorius and pectineus. The posterior division gives off one cutaneous branch called saphenous nerve and muscular branches which goes to the quadriceps femoris muscles. In this diagram you can see the femoral nerve arises from the lumbar plexus within the substance of the psoas major muscle, emerges from the lateral border of the psoas major muscle, descends downward on the lateral side of the femoral vessels outside the femoral sheath and behind the inguinal ligaments. And below the inguinal ligament it will be divided into main branches. These are the posterior branch and the anterior branches. Saphenous nerve, this nerve runs downwards and medially and crosses the femoral artery from its lateral to its medial side, and it emerges on the medial side of the knee between the tendons of the sartorius and gracilis muscles. Then it runs downwards on the medial side of the leg with accompaniment with great saphenous vein, and it passes in front of the medial malleolus and along the medial border of the foot, where it terminates at the region of the ball of the big toe.